superior, inferior. Real simple. And you also saw it here on this guy. Remember this? Superior sagittal sinus. So you see those in these two places for sure. We okay with that? Sigmoid sinus. The demonstration of it is with this guy here. So you see this one that's kind of, this blue that's kind of twisting in and going right for this hole. What's that hole I got my Q-tip in? Jugular foramen, yeah. You didn't think I would ever ask that again, huh? So here, here we go. We can have a skull with a Q-tip through and asking you, what vessel's going through it. So here, this is the sigmoid, where it's winding around here and going to there. And though it comes to the jugular foramen, and then it's going to turn into, whoops. Help an old man get that. And it's going to then come out as the internal jugular vein. Okay? So you can see it on this thing here. Everybody okay with that?
It's which one? The blue?
Yeah, this blue where it's going like this.
Okay.
Right here. Okay. So, internal jugular vein, where do you see that? You can see it right here. And this little part right here. It's also this little part that's coming into the subclavian right here. So this is the internal jugular right here. And it's sitting right next to the common carotid artery. Okay, so that's another one where the name is different on the vein than in the artery. Okay, internal jugular. Don't really see it over here on this guy. External jugular, you can see it right here on top of the sternocleidomastoid. You can see it real good right here. Okay, external jugular. And here it is here. Okay. That blue right there would be I think that would be the internal jugular. It's hard to tell, but I would guess it's what it's supposed to represent. Okay. So, brachiocephalic veins. That's what the subclavian and internal jugular dump into. So this is the right brachiocephalic vein right here. And here's the left brachiocephalic vein. That would be the internal jugular. That would be the subclavian. Now, see this little thing coming in right here? That would be where the external jugular is coming in. And so it just empties in the subclavian. This little bit is still subclavian right here. This is internal jugular, but now as soon as you get here, this is the left brachiocephalic. In some books and literature, you'll see this left brachiocephalic is the other name for it is innominate vein. So if you ever hear about the innominate vein, that's what that is right there. Okay. Central venous catheters, two main types that we use a lot would be a subclavian catheter or internal jugular, called an IJ. Okay. And the difference between those two is how they're placed. The subclavian goes right into the rib here to get into it, and IJ comes in the neck here. So the catheter would come out in a subclavian. Some of you are going to be nurses are going to take care of these. Much easier to take care of because you just take it and wind it and put it on a dressing right here. It's on their chest wall. You can move your arm and your head. It doesn't bother you. An IJ comes out, and you got to wrap it around the ear. The patient, moves their head, and it's not that comfortable. The anesthesiologists all put IJs in internal jugulars. Why?
It's closer to them.
Right. Because here's the patient on the operating room table, and here's the head, so they can get to it. The arms are out like this on an operating room table. They'd have to walk around, and usually it's draped, and they really can't get to it. So they just put IJs in. They're really good at it. Okay, so those brachiocephalics empty into the superior vena cava.
EJs.
Okay, right here. And remember here it is here coming in superior vena cava. Okay. So, and this, remember, was on the heart, the inferior vena cava right here. Okay. And the liver sits here. So if this is inferior vena cava, this is all inferior vena cava. Okay. You see the same thing over here. inferior vena cava here. Here's the right subclavian right here. Okay. Pulmonary veins. Is this the pulmonary vein?
Yes.
Remember, pulmonary circulation is opposite. That's the pulmonary
On
artery.
the right.
Here's the pulmonary vein. It comes back, remember, and empties into the left atrium. So those are pulmonary veins. Remember, we saw those on the heart, too. Okay. So same thing here. These are the pulmonary veins coming in. The reds are the pulmonary veins, the blue are the pulmonary arteries. Don't forget that, okay? Remember how it switches in the pulmonary circulation, okay? Veins of the arms, superficial veins. You have a vein coming up superficially between the skin and the muscle on the lateral side, and that's the cephalic vein. The one on the medial side is a basilic vein, and then right here where you get blood drawn is the median cubitus, okay? Now, we don't have really great models for it, but you can see them in a couple spots. See this vein right here? That's a cephalic vein on this model. It's coming up the arm and it's coming in here. This vein right here would be the basilic vein, okay? Right here. Now, if you look at the key, there's two numbers here, and they'll say that this part's the basilic, this part here is axillary. That's not anatomically correct. Your axillary vein is much deeper than that. This has to dump into it. So we're just going to say this is all basilic, okay, for our argument's sake. There's this guy right here, too, and it shows you right here the superficial veins. And so this one right out here would be your cephalic, this would be your basilic, and these are those median cubitals right here, okay? And you can see here the deep veins running with the deep arteries, okay? And those are, the deep ones are named the same as what we saw with the arteries, remember that? But none of the models show the veins next to them on the arms. So what we would do is tag like this one here, which is the brachial artery, but we could ask, what's the vein that sits right next to it? So you always got to be careful how you read the question. We could tag something but ask you what's next to it. You know, same thing, you'll have a vein right next to the radial artery, so you have a radial vein and an ulnar vein, okay? So, axillary vein too would be this portion down here would be next to this. Again, subclavian, you can see. Intercostals, do you see those in here? We okay with those? Here, you see this one right here too. Okay, runs right next to the artery. Azygous, hemiazygous. Now these we didn't have arteries for, right? So azygous and hemiazygous, you see them on two different models. This vein here running up and down in the right chest on this model is the azygous. You see it right there? This guy going up and down like that. Okay, that's the azygous. You don't see the hemiazygous on this side because of the model the way it's made, but you can see it here on this guy. So here's the hemiazygous right here. You guys see that okay? Okay, so that's hemiazygous. Inferior mesenteric, superior mesenteric splenic vein. Remember, this was the inferior mesenteric artery. Here's the inferior mesenteric vein. Here's the superior mesenteric vein. This would be like the splenic vein here next to the splenic artery. Mesenteric artery, mesenteric vein. I mean superior mesenteric vein. Splenic vein right here. Okay. Splenic artery, splenic vein. Okay. So you can find these on multiple different models.